Hi, my name is Megan. I'm going to be doing your cardiac assessment today. Can you verify your name and date of birth, please?
Nicole Hoof, June 19th, 1993.
Okay, I'm going to wash my hands for 20 seconds. I'm going to inspect your precordium area. So I'm just going to look at your skin for color and temperature, which is warm, and moisture, which is dry. Next, I'm going to also take your carotid arteries. I'm going to listen to your arteries before I palpate them to make sure that I don't disrupt any blockages and cause any damage. Can you turn and look to your left, please? Okay, to your right. Okay. Now I'm going to palpate. And while I palpate, I'm just going to hold my hand very still. I'm not going to move. That way I can just feel for your pulse. Okay. And we don't want to do both sides at the same time, or we could cut off the circulation of blood to your brain and you could pass out. Okay, so next I'm going to palpate your angle of Lewis, and so that is where your ribs connect to your sternum. Okay, and everything connects properly. Next, I'm going to palpate your cardiac landmarks. I'm going to do this over top of your shirt for video purposes, and then when I auscultate, I will go beneath your shirt. Okay. So this is your aortic, pulmonic, herbs, tricuspid.
My stomach's growling.
And your bicuspid or your mitral, which is under here, your fifth intercostal space. Okay, now we're going to auscultate those. So I'm going to use my stethoscope, the diaphragm of my stethoscope. So that's your aortic. Sorry, get my hand straight. Pulmonic. Herb. Tricuspid. Sorry. And your mitral. Okay, everything sounds great. Now we're going to do an aortic valve screening. So I'm going to have you sit up for a moment, please. Lean slightly forward. And then I'm going to need you to exhale completely and hold your breath just for a couple of seconds. Okay, perfect. All right, now I'm going to have you lay down, and slightly on your left side, we're going to listen to your mitral valve screening. We're doing this so that way your mitral valve presses up against your rib cage and we can hear it better. Same thing, I'm going to need you to breathe all the way out, exhale, and then hold your breath. Perfect. Okay, you can lay flat on your back again. Okay, so now I'm going to assess your pulses. So we've already done your carotid. Now we're going to do your brachial. And we're doing these at the same time to make sure that your pulses are equal bilaterally. Okay, radial. Okay, we're going to do your radial and your carotid. Can you look to your left at the same time? Are you really hungry? Okay, we're just making sure that there is no disruptive blood flow. That's meaning you're. Okay, so now we're going to palpate your aorta. So we're looking right here, below your sternum. Okay, your femoral. Is that your hip line? Popliteal, and knees. Posterior tibial. And pedal. Okay, everything's great.